Hello everyone. Today's topic is hypoxia. What is hypoxia? Definition. When body tissues receive less amount of or reduced amount of oxygen, the condition is known as hypoxia. In case of hypoxia, body tissues or cells do not receive adequate amount of oxygen. Oxygen is less in amount. Adequate amount of oxygen is not received in tissues and or cells. This is hypoxia. Now there are two types. There are two types of hypoxia. Number one, local and generalized. Generalized hypoxia. Local means in some part of the body. In some part of the body there is hypoxic condition. Suppose in some ischemic condition there may be hypoxia in one, say, left upper limb or right upper limb. This is local type of hypoxia. And second is generalized. Generalized means whole body is hypoxic. Hypoxic means whole body is suffering from loss of or reduced amount of oxygen supply. Hypoxia. Now, one anoxia. What is anoxia? Anoxia is complete sensation of cessation of oxygen to tissues. Complete cessation. That is anoxia. Now, coming one term is hypoxemia. One term is hypoxemia. That is less amount, a reduced amount of oxygen in blood. This is hypoxemia. And anoxemia means no oxygen in blood. Oxygen is not present in blood. Hypoxemia, less amount of oxygen is present in blood. Therefore, hypoxia and hypoxemia are not similar terms, they are different. Now coming to types or pathophysiology of hypoxia. In hypoxia, one thing is partial pressure of oxygen. Partial pressure of oxygen is less. Partial pressure of oxygen is low. Second, diffusion of oxygen is impaired. At lung and tissue level. Number three, carrier of oxygen. That is, hemoglobin is amount of hemoglobin amount is less. Hemoglobin amount is less. Then fourth, stagnation. Blood flow is not proper. Blood flow is not proper. And fifth, tissues or cells fail to use oxygen. These are 5 conditions in which hypoxia may occur. Partial pressure of oxygen is low, then diffusion of oxygen is impaired at lungs and tissue level, hemoglobin amount is less, blood flow is not proper, and tissues or cells fail to use oxygen. Types of hypoxia. Types of hypoxia. Number 1, hypoxic, hypoxia. Anemic hypoxia, stagnant, hypoxia or ischemic hypoxia. It is also known as ischemic hypoxia. And fourth is histotoxic, hypoxia. In hypoxia, partial pressure of oxygen is low. For example, in certain conditions or at high altitude, partial pressure of oxygen is low. Then, when weakness of respiratory muscles, especially of respiratory muscle, is there, or depression of respiratory centers due to drug or disease, in all those conditions, or overcrowding at a closed place, this hypoxia will occur. Number 1, at high altitude where partial pressure of oxygen is low, then in closed chamber with many people, overcrowding, and muscles, then in muscles where respiratory muscles especially is weak, not working properly, respiratory centers are depressed. In all these conditions, hypoxia will occur. Second is anemic hypoxia. Anemic hypoxia means due to anemia, oxygen carrying capacity of blood is low and therefore hypoxia will occur. Then stagnant hypoxia or ischemic hypoxia. Blood is not flowing through blood vessels in certain local, it may be local or generalized. For example, myocardial infarction or congestive coronary failure or heart failure, congestive failure. And then histotoxic hypoxia, tissues or cells are not able to utilize oxygen. This occurs in certain poisoning, especially cyanide poisoning, which blocks cytochrome oxidase in the cell and oxygen is not utilized. These 4 types of hypoxia. Now symptoms of hypoxia. Symptoms and signs of hypoxia. Symptom means patient symptoms and signs. Symptom is nausea, vomiting, palpitation, drowsiness, headache, and tremor. All these things may occur in hypoxic condition. Although they are not specific, but these occur: nausea, vomiting, headache, palpitation, drowsiness, and tremor. These are symptoms and signs. Tachycardia, tachypnea. The tachycardia means increased heart rate. Tachypnea, rapid respiratory rate, and confused condition of the patient. These are signs. How to diagnose? This condition, the SpO2. Very simple, easy and quick method to diagnose hypoxia is SpO2. By pulse oximeter, we can know the condition. Normal is 94 to 100%. Normal must be 94 to 100%. When it is below 94, it is alarming condition. Condition is alarming, and below 60%, it becomes grievous condition, and treatment must be started immediately, otherwise coma, convulsion, coma and death may occur. This is diagnosis. Now management. Management depends upon the cause of the hypoxia. Suppose anemic hypoxia is there and hemoglobin content is very low, then blood transfusion is indicated. When hypoxemia is hypoxic hypoxemia, then oxygen must be given, oxygen therapy, and this is due to myocardial condition, congestive cardiac failure or myocardial infarction, then we have to give proper treatment of that condition, and also in histotoxic conditions. Oxygen is given, and in some cases hyperbaric oxygen therapy. Hyperbaric oxygen therapy is given. Oxygen is given at high pressure. It is hyperbaric oxygen therapy may be given. This is about hypoxia. So, in this video, we learned about definition of hypoxia, difference with hypoxemia, then types of hypoxia, signs and symptoms of hypoxia, diagnosis of hypoxia, and management of hypoxia. This is all about hypoxia in nutshell. Thank you very much for watching. Please like and share this video and subscribe this channel. Thank you very much.